My name is Dr. Lee. I am the contracted Chinese medicine doctor for Integrative Medicine Department at Moffitt Cancer Center. I've been working at Moffitt for about 7 years now, and I have my master's and doctorate in acupuncture and oriental medicine from Pacific College of Health Sciences in San Diego. I also have a master's in functional medicine and human nutrition from University of Western States. I used to be a former professor there as well, teaching functional medicine and biochemistry. I'm Lastly, well, the last thing for now that I'm doing, I'm also the head medical advisor for an herbal company in New York City. I am in charge of R&D and clinical trials for the company. So I'm going to go over the agenda. So I'm going to speak very briefly about, give you guys an overview about Chinese medicine, the main medicine that I practice. Also the 5 elements and how Chinese medicine believe in mind and body connection and how expressing our emotions is really important. The use of acupuncture to support those that are going through cancer treatment, but also during survivorship. A brief mention on the importance of massage yoga for cancer patients, and also a very brief discussion on nutrition and diet from a Western Eastern perspective. Can we move to the slide, the tenants, slide 4?
Okay, so the tenets of wellness, I believe this is the 7 things that I always talk to my patients about that I feel that's very important. Is hydration, making sure that you drink about half your body weight in ounces of water. So if you weigh 150 pounds, you should be drinking about 75 ounces of water a day. And of course, you can add flavoring to it, lemon slices, orange slices, fruit in there to kind of jazz it up if you want. Movement, and it does not have to be an intense workout. It could be gentle yoga, be stretching, walking, even doing weightlifting with canned foods in your hands. Nourishment, making sure that you're eating for yourself and listening to your body, your body's needs. If you feel hungry, eat. And if you don't feel like it, you don't have to. But making sure you get enough calories and nutrients in your body. Expressing your emotions is so important. I feel like I can't stress this enough. That's why I'm going to start talking about this in the next slide. But to me, with Chinese medicine, that the mind-body concept is been around for 5,000 years in our medicine, and the last few decades in Western medicine. And I'm love seeing how Western medicine is finally catching up and realizing that our emotions and what we experience and how we feel actually affect our health. Self-care, and I'm not talking about getting your hair done and getting your nails done, but also getting massage or having quiet time for yourself, and being able to say no is also self-care. Getting adequate rest and sleep. A lot of my patients, a lot of the times, feel guilty when they need to take a nap, and I tell them, take a nap, because your body's telling you need to take a nap. And most importantly, especially after the holidays, because I talk a lot about boundaries, is it's critical for your health, and especially mental health, is being able to say no and keeping toxic people and situations out of your lives. Especially during the holidays, my patients always feel guilty when they don't want to be around certain people and they feel compelled that they have to be. And it definitely affects how they feel and their stamina through their day. All right, Kathy, next slide. So I mentioned briefly, Chinese medicine has been around for thousands of years. I say 3,000, but there's also evidence that dates all the way back to 5,000 years. And the concept of restoring health is more than just merely the absence of disease. In Chinese medicine is about balancing, trying to balance your body as much as possible, and just having your body function effectively and efficiently as possible wherever your stage in your journey is in your life. Understanding the body is an integrated whole, meaning mind, body, and spirit. The mind and the body is connected. You can't separate the two. Chinese medicine is a system of medicine. When people think about Chinese medicine, they often think just Chinese herbs, acupuncture, and usually that's about it. But there is exercise involved, like Tai Chi and Qigong. Personally, I can't do either of them. I like a little bit more flavor in my workouts, so I do more Pilates and dancing instead. Tui Na is a very specific type of Chinese massage, diet, and mental health. Now, hospitals in China, they actually have a Western division and an Eastern division. So when you go see a doctor there, they can tell you, hey, go see the neurologist, but also get a massage. Or go see the neurologist for your issue and get acupuncture. So they're integrated over there in Asia. So over here, unfortunately, I'm in a small department at Moffitt, but I'm quite busy trying to keep up with the patient load. But Chinese medicine, again, please remember, is a system of medicine. So yes, I do all of that stuff for my patients. Next slide. So here's a concept of Chinese medicine that is the foundation, is the yin and yang. A lot of people have heard it, but don't really know what it is. So yin is the nighttime, the dark aspect, the nourishing, the wet, the moist, and the yang aspect, or some people might say yang, is the energy, the sun, the heat, the dryness, and they balance each other. And we experience this through our day, like daytime is yang, nighttime is yin, and the dusk is that transition from yang into yin. And now, you guys probably apply concepts of yin and yang already in your daily lives without even realizing it. So like the summer when it's hot, and actually Florida is always hot. So you guys probably more apt to eating more fresh salads and fruits and vegetables, wearing short, like lighter clothing. So outside is hot, and so you're eating cooling foods like raw foods and wearing light clothing to cool your body off. So that's the concept of yin and yang. You're already applying it. Now, during the winter, when it's colder, what do? You probably want to eat more soups, roasted foods, baked foods. That's more warming, and the food is already cooked, so your body doesn't have to use as much energy to digest it. Outside is cold, you're eating warm foods. And what do? You put on a coat. When you sleep, you put a heavier blanket on. So you're already applying the concept of yin and yang, and what we think in Chinese medicine and how we use that to work with our patients. All right. The next one, qi and blood. These are two common words that I use in my medicine quite a bit. Qi, loosely translate, is energy. It's the force that allows us to move, to allow us to breathe, and it's the force that actually circulates blood throughout our body. Now, energy is loosely translated, meaning, because this is a concept from thousands of years ago. So when we say, excuse my energy in Chinese, when you translate that, that means sorry. So when we apologize, we're like, oh, so sorry, please excuse my energy. And blood is not just the red blood that pumps through your body, but to us in Chinese medicine, having healthy and an abundant amount of blood, meaning that you're eating enough to nourish your body. So when we breathe in air, we eat food that actually promotes the generation of qi and blood in our body. Now, my medicine is like 5,000 years old. There wasn't TV around. So what did these doctors do back in the day? They would observe nature, and they just see the connection, happening in nature within our body. So, the tree grows and sprouts, and the fire burns the trees, and it condenses, it becomes earth. And when earth condenses even more, it becomes metal, and the condensation around the ore and the metal is water, and water waters wood. So they see how the interplay between these elements in nature, and they see how it happens in our body. So like wood is in charge of planning and judgment and making decisions, and it allows us to move through our lives. And is it dinging? Is that people jumping on?
Yes, sorry
people
about that.
Joining. People are joining.
Yes, they're joining.
So like wood, like is the emotion that ties in with associated with the wood element is anger, frustration. If you notice how that green line goes over to earth, right? Earth has to do with the digestive system and digestion. So when some people that has a strong brain gut connection, when you get angry and frustrated and stressed, some people might see digestive issues. And so like people with the IBS, or some people when they get stressed and they clench a lot, they might experience constipation. Overthinkers tend to have looser stools and feel gas and bloaty. So this is a concept that we use in Chinese medicine to kind of see what elements are off balance, imbalance in your body, and we try to put that back into balance. And we encompass all of these 5 elements. It's just depending on which one is off. Next slide. Again, I mentioned briefly like the emotion that ties in with the liver is anger. The heart has to do with love and connection, but also the heart element is fire, and when there's a dysfunction, you get anxiety. Spleen and stomach is the earth element, and this is about love, the love that you have for your family, taking care of people. However, the imbalance of that is overthinking, overprocessing. The lung has to do with grief, and the kidneys has to do with fear, but also the will to do things. And let's go to the next slide. This slide, if you look at it, will tell you a lot. For like the wood element right there, anger, irritability. I already gave you an example of like, say, if wood is abundant and you're angry and frustrated, and it can attack earth. However, when you get angry and frustrated, it can also attack the water element and can make your water element a little bit weak. So when you're angry and frustrated about something, say at work or life, that makes you also have self-doubt in your decision making, that was something that I would work on to kind of help support your body. And this is one thing about when I see my patients, especially working with cancer patients, they don't realize that when they're coming into me, I'm going to be asking tons of questions, and they think I'm nosy or digging into their personal lives, but I'm trying to build this profile to see what your body's personality is, because that is the foundation of how I would work with you. And so I think it's very critical to get to know my patients and their personality, because that lets me know how their body functions before they even tell me what's wrong with their body. Or if you're going to go in for a procedure or something, I kind of can guess how your body might react to it. So, like I mentioned, in working with breast cancer patients, I will tell you the common element that I see a lot is wood. So wood has to do with the liver and gallbladder, the organs in Chinese medicine, and it rules the upper hypochondrium right here, the chest. And a lot of my patients tend to hold in their stress and they hold in their emotions, and they really don't get to express it or have a chance to express it effectively. That's number one. And the other one is the earth element. These are the mothers, the one that take care of everybody. They take care of the house, the family, they coordinate everything, they love on everybody, they take care of everybody, but they also forget about themselves. So that's why I talk about how important self-care is. All right. Another thing about Chinese medicine is those meridians and the channels that everybody hears about. So I'm sure you've seen pictures kind of like that picture where there's points around the body. These acupuncture points in the channels, meridians, actually follow a lot of the nerve pathways in our body that a lot of people don't realize. So why would stimulating a point here on your hand can help with headache? Because actually there's nerves that travel all the way up to our head. But they didn't know that 5,000 years ago. They just had 5,000 years of experience needling those points and seeing an association. Oh, whenever I needle this point, there's benefit to headaches. So now that modern day research, we know there's nerve pathways. And click again. So there's a saying in Chinese medicine that I love so much is when there is free flow, there is no pain. When there is no free flow, there is pain. Meaning that when we have appropriate circulation in our body, when you're expressing your emotion, and that's circulating. When you are exercising and that's circulating, when you're drinking enough water and there's enough fluids and blood in your body to circulate, there shouldn't be pain. When there's no blockages in your body, if there's a bruise or an injury or something going on, there shouldn't be any pain or health ailments. But when there's no free flow, that's when pain and ailments occur. So acupuncture increases circulation in our body and encourage, not only acupuncture, Chinese medicine, when you express your emotion, you feel freer and things are able to flow better. And that reduces pain and ailments. It's kind of like when you get to talk to a friend and vent about a situation, your shoulders naturally drop down, or even take 5 minutes to just do some breathing, you relax. Things are just circulating better. The breath goes in better, and you just feel a lot more relaxed. And just by doing that, you get a lot more health benefits because de-stressing lowers inflammation. Next slide. Most importantly, I'm going to tell you what acupuncture is not, because these are common things I've heard through the years. Go ahead, click again.
We do have one question that just got dropped in the chat, Dr. Lee.
Yes.
How do you treat neuropathy after chemotherapy?
Okay, so I do have a slide on that on a study, but I'm just going to mention really quick. So this is something I treat quite often. About 30% of my day I treat neuropathy, and I also completed a clinical trial last year on this with Moffitt. So what I do is neuropathy on the feet or the hands is usually the typical places where people experience chemo-induced peripheral neuropathy. So what I do is imagine this is your feet or just your hands. I would needle between each digit, and then I would hook it up with electrical stimulation. They're specifically made for acupuncture needles. I clip them and I turn that on. And what it does is it stimulates the nerves in your hands and feet to encourage more blood circulation and nutrients to get to the distal areas of your fingertips and your toes. So that way it can encourage the healing of those nerves. So acupuncture is not based on religion. Get that asked quite a bit whenever I do a presentation for Moffitt for patients. And the next one is not energy medicine, is not magic or voodoo. Is not an alternative to conventional cancer treatment. My job is to support you before, during, and after your journey. And it does not target tumors or prevent cancerous cells from spreading. However, it provides significant benefits in cancer care. And the next slide is definitely not what it looks like in movies and TVs and comedy shows. Because if you see those needles in the chest, your lungs is underneath there. We would never needle in that direction. And the length of those needles are usually used in the tuchus, the media parts of your body. So it's definitely not this. I will tell you, a lot of my patients fall asleep. Next, go ahead and click through again. So it involves, what is acupuncture? Acupuncture involves the insertion of a very thin sterilized needle, single use. I do not reuse them, into specific points of the body to promote healing. It's safe, is virtually painless, depending on the provider that you go to, and extremely low risk of complications. I treat patients that are post-BMT, bone marrow transplant. I treat patients before they get their bone marrow transplant. And for me, I always make sure I try to check my patients' platelets level and their white blood count whenever possible before I treat them. So how does it work? The exact mechanism is not fully understood, but these are based on research, the suggested mechanism of action for acupuncture. So I talk a lot about how it increases circulation. Just click through, Kathy, sorry.
No, that's okay. No, we actually have a question in the chat.
Yes.
I was trying to find a good time. We look like we're on a roll. Someone wants to know, do you also ask emotional questions in your client intake?
Yes, I do. I always do. And of course, some patients don't feel like talking about it. That's totally okay. But I would tell you most of them, they do. Because I see their face and they tell me, they're like, oh, I'm fine. I'm like, are you really? They tend to open up when I say, are you really? We all go through things and we're human. We're allowed to feel. So yes, I think it's very important to talk about emotions because our body's connected to our emotions. So back to how it affects the hemodynamics, increases blood circulation. It actually affects how our blood vessels contract and dilate. So it reduces heart rate. It can lower blood pressure, not to a point where you feel lightheaded or like dizzy. Go ahead and move to the next slide. And click again, sorry. It's same. This is the most important. Our body is full of nerves. It's covered in nerves. So without a doubt, it affects the nervous system. And it helps block the pain pathway. Oh, no, go ahead, dear.
Oh, sorry.
And it stimulates the brain to release natural painkillers, hormone called endorphins. And it also improves our mood. Which goes to me always saying that I think I have the best job at Moffitt because I'm the only doctor at Moffitt where patients like to see and they walk out smiling and relaxed. And also there's an anti-inflammatory effect to it because it lowers cytokines, inflammatory proteins. And it can help modulate our immune system. It helps with healing. And this is where it helps with adenosine release. Specifically, it helps with people that are experiencing peripheral neuropathy. Now, a lot of people that have looked up, will acupuncture do this? And so I get patients who are like, does acupuncture really work? Or is it just placebo effect? So the issue that we have with acupuncture is I don't treat a patient the same points all the time because every time you come in, something else is going on. You might feel differently that day. So I would choose different points in my treatment approach. Now, we're so used to when you go see a doctor and 5 patients would have headaches and the doctor would probably give the same recommendation. However, for me, I would probably recommend or do different things with each of my patient differently because of the headaches. Some people might get headaches because of a food trigger. Or a patient might get headaches because of stress. The other one may be muscle tension. Another one could be their mother-in-law driving them crazy. Or it could be any of those things. So I would treat them differently. So with acupuncture research, because the studies are designed very differently, it's kind of hard to, when you look at research, they say, oh, it doesn't really show a benefit because each study is designed so differently. And Chinese medicine is personalized medicine, and you can't really use the same formula or the same points on everybody because it's not appropriate. It's not clinically relevant to us. And go ahead and click the next slide.
Someone actually asked, she said, I heard there's a deeper needle / traditional acupuncture, which could be painful versus a less painful, less deep acupuncture. Is this true? And is one better than the other?
Okay, so if you don't mind waiting, there's going to be a next slide where I talk about the different styles of acupuncture. So that would be the best place to get your answer.
Okay, one more question. Are repetitive treatments needed?
It depends on what you're treating. So say I have patients that come in to see me for neuropathy, but if you're currently under treatment and you're getting chemo that causes neuropathy, then I would say, yes, you would need to get it a little bit more consistently through your treatment because the drug itself is going to continually attack those nerve endings. Now, a lot of the times, majority of my patients find me after the treatment. And that's when I always say, get 6 treatments, see if you're a responder or not. And then we can determine how many more treatments you need. And, I might not be able to get rid of the neuropathy fully, but at least increase quality of life and definitely turn down the volume of the numbness or the pain that they might be experiencing. So it depends on what you're getting treated for. Double-blind randomized controlled trials are the ideal trials, but if you look at this picture, are they truly randomized and controlled? Because some patients would get the actual acupuncture and the other one doesn't. But if you notice how that needle doesn't break through the skin, I will go to that, but that's Japanese acupuncture. Japanese acupuncture doesn't always penetrate the skin. They stimulate on top of the skin because it's actually working their cutaneous nerves versus going into the deeper layers to affect the other nerves. Placebo. And go ahead and click for the next one. Is it a placebo effect? In medicine in general, we use there as a natural phenomenon. Placebo effect does happen. That happens even with antidepressants. Typically antidepressants don't work for 4 to 6 weeks. However, we all know that we have patients that feel better as soon as they start it within a day or two. So my question for you guys is, if it's truly a placebo effect, and there's a lot of animal studies, if the animals are feeling better, is it really placebo? So the different styles of acupuncture. So there's Chinese, Japanese, Korean, and there's many other different styles. Chinese definitely penetrate the skin. Japanese, there's barely penetrates the skin or just stimulating the cutaneous level. And Korean tends to focus more in needling the hands. Probably not my personal favorite. Because I personally think that's a little bit uncomfortable. But depending on the provider that you see, everybody has a different style and personality. So I always say, a provider that you're going to see, they're going to treat you the way they like, the way they know, and the way that they prefer. I like to be tend to be on the gentle side because I tend to baby my patients a little bit and spoil my patients. My parents, I grew up in the salon business, so it was always about making people feel comfortable. So I want my patients as comfortable as possible. That's just my personal approach. That's why a lot of my patients tend to fall asleep when they come and see me. They get a great nap. Now, my colleague in my office does sports medicine, and he's a little bit more aggressive, but then his patient base is a little bit different. They are okay with a little bit more aggressive. So dry needling, I'm sure some of you guys have heard dry needling. There's chiropractors and PTs that are doing dry needling. Trigger point, muscle motor point. Now, that's basically all acupuncture. Some might argue it's not because they're not using acupuncture points, but it's more of a licensing thing. So dry needling and trigger point, muscle motor point is about when you got, say, a tight trapezius muscle here, you feel that little ball of knot, we'll stick a needle in there, stimulate it, get it to jump and relax. And electroacupuncture, just like the picture there, there are certain treatments where I feel like it's more effective. I like to stay more on the more relaxing side of things. So I don't use e-stem quite a bit unless I'm treating neuropathy. But sometimes when I'm working with somebody with really severe back pain and the regular treatment is not getting the benefits that I hope would see, then I would add the electroacupuncture. Basically, between the red and black leads, electricity is being sent through, and you feel a little vibration. And sometimes, depending what muscle group that you're working on, the muscle might vibrate and dance a little bit. So sometimes when I have to work on my patient's hip or lower back, and especially in their glutes, when I turn it on, it kind of dances. So I tell my patients, like, the one time in your life where you can twerk. All right. So this is based on research, the benefits that cancer patients would get, I would think that be beneficial for patients, for especially pain reduction. That's what we're known for. That's our game. Reducing stress and anxiety. It helps with depression and insomnia. Helps with the various side effects of chemo, especially nausea and vomiting. Dry mouth, I do that a lot. I work very closely with the head and neck cancer department at Moffitt because of radiation. It can destroy the salivary gland, so I can stimulate to get them to start releasing saliva again. Neuropathy, definitely. Hot flashes for those on aromatase inhibitors. So that is another common thing I treat is hot flashes, or patients that are going through treatment for other cancers and they happen to be going through menopause. And of course, helps support the immune system. I don't want to bore you with research, but here's some research right here that was published in ECAM that shows that it's beneficial for hot flashes. You can just click through and and I try to choose studies that meta-analysis or systematic reviews because it's looking at a whole body of research. So this one is on the benefits for breast cancer patients. This one shows that it improves quality of life, reducing pain, helps with fatigue, hot flashes, and sleep issues. Now, this is specifically on electroacupuncture and for pain. So it shows that electroacupuncture is beneficial for pain. This one is for the pain that you might experience from taking an aromatase inhibitor, like tamoxifen or anastrozole. And this is compared between a sham, so it's showing that true acupuncture is more beneficial than sham acupuncture. The sham one is when the needle doesn't actually go through the skin. I mentioned about the dry mouth, the xerostomia for head and neck cancer patients. And neuropathy, again, how it helps with neuropathy. This one is my personal director at Moffitt. She did this study and we surveyed patients. And one of the things I didn't put in here, that one of the questions was, do you believe if acupuncture works or not? And so the belief in acupuncture, whether it was going to work or not, does not affect the outcomes, but shows that patient got benefits in their symptoms just with a couple acupuncture sessions. So what makes acupuncture different? It's individualized. It treats the mind and the body, has little to no side effects, improves quality of life, which is so important to me because that makes me happy when my patients are feeling better and having better quality of life. My joy is to help my patients thrive through treatment. And I think it's practical. I mentioned, like, if you have tight muscle right here and just by needling, the muscle relaxes, it is instant. That's when my patients get instant relief, or my patients come in with a migraine or a headache, they get instant relief. So it's very practical. Common question I always get, does insurance cover it? Depends on your policies. And if you're on Medicare or Medicare supplement, here's the thing, you guys, there is coverage, but not when it's done by an acupuncturist. So it has to be somebody with an MD or working under an MD, a nurse practitioner or PEA that has acupuncture background that's working under a doctor. So that's the make it make sense. I have no clue why Medicare had that guideline. And how many treatments do you need? I mentioned this earlier, that it depends on what you're getting treated for. So if you're coming in for a tight shoulder and it's just acute, probably just one. But if something's chronic and it took time to get there, it might take a couple of treatments or a handful for it to resolve. Massage. Who does not love massage? Except for those that doesn't like to be touched. There are a few people out there. But massage therapy for me, massage therapy is a part of my department. And I love the ladies that work in my department. But these are the benefits that you will see from getting massage. And this is part of self-care. Whenever you can, definitely try to incorporate massage into your care. Spoil yourself, treat yourself. I always tell my patients, instead of buying me a gift during the holidays, please give yourself a massage. It improves the quality of life, reduces stress, it helps with sleep, helps with fatigue. It can also help with neuropathy. And also, especially post-surgical swelling, it helps move the lymphatic system. And definitely, if you're having lymphedema, work with a lymphedema specialist. just don't go to any massage therapist because they can actually hurt you more. Specifically for my breast cancer patients, I always tell people, look for a massage therapist that's with the Society of Oncology Massage. You can go into that site, s4om.org, to find a massage therapist that's trained in oncology massage, because you have to be careful who you go to. Not everybody is well trained. You don't want to hurt yourself. Working with somebody that is qualified might be beneficial for you. Yoga. We have Valencia. I know some of you ladies already did your yoga the last time with Valencia. So I'm going to keep this brief because I probably won't do it any justice. Yoga is so important because there's breath work with it, there's stretching, there's movement with it, there's mindfulness with it. There's so many health benefits. There's so much research on yoga and mindfulness in general. Helps with fatigue, it helps reduce stress, improve physical function, and definitely improve sleep. And this lovely model right there is one of my people, and she teaches yoga at my office as well. She is a patient of ours at Moffitt, and she's obviously our model. And, going through her journey, she got to a good place and she got certified as a yoga instructor, and she's teaching at my private practice. Okay, nutrition. This is a hard topic because, eat better, eat your fruits and vegetables. That's true. But I'm going to try to change it up a little bit for you guys. Obviously, eating well and eating healthily through your treatment and after helps you feel better, recover better. It just feeds your body so you can help nourish your body and heal. It helps with your immune system. Next slide. Okay. Something I didn't say. I'm actually from California. I'm in Florida now for the last 7 years. So working with cancer patients back in California is awesome. It's really interesting because in Southern California, this is like the mecca of healthy. And whenever I worked with patients, they come in, they're like, I just been diagnosed with cancer. I'm becoming vegan. They're gung-ho, they're going to do it because where I'm from in San Diego, we have grocery stores and restaurants that supports that lifestyle. But unfortunately, not everywhere is like that. And it can make it difficult for everybody. So just because, I will say this, just because somebody is going through a cancer journey and you hear people talking about going vegan, I'm all for it if you want to do it, but it's not quite sustainable for everybody. So I want to talk about the reduction in all-cause mortality. And I use this when I taught functional medicine to teach my students that, yes, veganism, there's tons of research on it that shows that those that implement a vegan diet there's a great reduction in all-cause mortality from cancer to heart disease. But if you go and implement a pescatarian diet where you're more plant-based and you eat fish, there's still a reduction in all-cause mortality. Not as good as veganism, but still it's much better than just the standard American diet. And this is based in comparison to the standard American diet. Now, Lacta Avo is a general vegetarian that eats eggs and cheese, dairy, and there is still a reduction in all-cause mortality. Now, there's an omnivorous diet, and there's many of them, like paleo, Mediterranean. Find what works for you. For me, it's more important about something that's sustainable. Think plant-based. Don't think about in terms of the titles of what type of diet that you're doing. Just making sure that you get enough proteins, carbohydrates, and fats. There's healthy carbohydrates like fibers, that complex carbs that are important. So the macronutrients, think of it as the gas that you put in your car to help your car run, right? The micronutrients is the vitamin, minerals, and antioxidants that you get from your food that you're eating. That's like the oil that helps your car runs better. So that's why it's important to eat your fruits and vegetables, because that's where you get a lot of the antioxidants from. Next slide. But for me, I always stress to my patients to try to eat as much fiber as possible. Did you guys know that only 2% of the US population actually eats sufficient amount of fiber every day? You should be getting at least a minimum of 30 grams of fiber every day, and you can get it from eating beans, legumes, cruciferous vegetables. There's a great source of it, fruits, leafy greens, grains, nuts, and seeds. So try to incorporate that. And if you can't, if you don't have the appetite to be able to eat 30 grams of fiber, supplement it. Take fiber pills, drink Metamucil. Personally, I like Console better. But having a sufficient amount of fiber relieves constipation from some of your medications you might be experiencing. If you have diarrhea, loose stools, the fiber actually helps fluff up your stools and condenses it too, believe it or not. But especially for breast cancer patients, this is about having a healthy bowel movement. It's really important to eliminate excess hormones. That's how we eliminate excess hormones. So if you're experiencing constipation, your body is actually reabsorbing the hormones and recycling them back into your body. And of course, it helps support the gut microbiome, which is the bulk of our immune system. Now, in Chinese medicine, I'm going to just talk about a simple concept in Chinese medicine. I talked about it earlier. Those of you that have gone through treatment or going through treatment, always hear or think that I got to eat raw so I can get the most nutrients out of my food. That's not always true, and it's not always healthy and appropriate for your body. So if you notice yourself feeling gassy or bloated or feeling like the food is not digesting well, stomach upset, or you're just fatigued and feel nauseous or having loose stools or even constipation after eating, then eating raw might not be for you, especially if you're eating a salad and you notice these symptoms, because your body is actually probably depleted and just overly tired, and your body's not releasing enough pancreatic enzymes to break down these food fibers. And that's why you're getting these symptoms. So in Chinese medicine, we encourage eating cooked foods, especially when you're feeling fatigued, because it requires less energy for your digestive system to try to warm up the food that you're eating and to break it down for you to absorb the nutrients from it. So with that in mind, let's go to the next slide. There are actually some foods that when you eat cooked, it's actually healthier for you. Like tomatoes. Tomatoes is very high in vitamin C when you eat it raw. However, when you eat it cooked, it actually releases the bioavailability of a certain antioxidant, which is very powerful and is known for cardiovascular health and also those with cancer, called lycopene. So lycopene in tomatoes the levels are higher when you cook it. And when you eat it with like something like extra virgin olive oil, you'll get better absorption. All right, so dark leafy greens are high in folate. However, by cooking it, you reduce oxalic acid, which actually is an acid that can actually increase risk of kidney stones. So by cooking dark leafy greens, you actually lowers the oxalic acid and increase the absorption of other minerals like iron, calcium, magnesium. Carrots cooked, you get higher levels of beta carotene, and carrots are just not good. I mean, not only good for your eyes, but people might not realize it's also really good for your immune system and bone health. So anybody have questions? Let's just jump to questions.
I think a lot of them you answered in the chat.
Okay.
But one is there a specific title for a breast cancer survivor acupuncturist? I'm thinking no. But you went over that. You did. Go ahead. You answer it.
Okay. So most acupuncturists are general practitioners. Some do specialize in various areas. They might highlight that in their website, but then there's a lot of people that just highlight everything. From what I know, like I'm in Tampa, I don't know there's anybody else that is specialized in cancer in Tampa area. So I can't really, there's no specialty licensing for specifically working with cancer patients. unfortunately. I do notice there's another question. What is the best acupuncture to choose for one is taking tamoxifen? What do you mean? What type of best acupuncture?
Maybe
So
we can come back.
if it's between like the different various styles, like say Japanese or Chinese, I would say any of them. It just depends on the provider's approach to treating somebody that's on like tamoxifen. So if you're having hot flashes or joint pain, anxiety from the medication, so it depends on the provider how they might approach it.
So she said, do I do Japanese, Chinese, Korean, etc.? Okay.
Depending, if you're like needle sensitive, definitely maybe look for somebody that's Japanese, or ask somebody that does Chinese acupuncture to be more gentle. And it's okay. And I will tell you, if one provider you don't click with and you feel like, this is not for me, try another provider, because everybody has different approaches and different styles. Like for me, I'm always kind of expressive and bubbly. I know I'm not for everybody.
Hi, thank you so much. I have two questions. One, how do you find a certified person that does acupuncture in your area?
Okay, so it's not certified in acupuncture. You want to look for somebody that's licensed acupuncture. So I will tell you, ladies, all this. When I first moved to Florida, I was very confused when I did research on like who's out there trying to find another cancer, like somebody that specialized in cancer. And I started reading everybody's bio, and they called them, they gave themselves the title doctor, but you would read their education and they only have a master's. So in the state of Florida, just to let you know, that an AP, which is an acupuncture physician, they're legally able to call themselves doctor because the licensing title is Doctor of Oriental Medicine in the state of Florida. However, I have a PhD level version of Chinese medicine. That's why my title is a DAOM, not a DOM. Just to let you know, so you can look through the Florida Acupuncture Board to find a provider nearby you.
So there is a website where you can see certified
if they're licensed or not. Yeah,
but they are licensed or not. And the other question that I had, when you talked about cooked vegetables like the tomatoes and spinach and carrot, is there any way that you recommend how to cook it to preserve those benefits?
Great question. So like broccoli, like for a lot of cancer patients, my favorite vegetable, if you can eat it, is cruciferous vegetables, broccoli, cauliflower, cabbage, because it contains sulforaphane and is a very powerful anti-cancer and helps support the body. However, I read studies, and I love this because they've looked at it, the sulforaphane levels from raw cruciferous vegetables versus cooked. The reduction is very negligible. So a lot of these foods, believe it or not, that you're not going to lose a lot of the nutrients, except for vitamin C. Vitamin C is very temperature sensitive. So like you're not going to get the high levels of vitamin C if you cook the tomato or the carrots. You're not going to maintain that, but then you can get that by mixing it up. So say you were to have roasted carrots and spinach, and then you can throw in some raw tomatoes in there, kind of mix it up. It's a balance of yin and yang, right? Eat some cooked with the raw. But you don't always have to eat raw. I come from Southern California. I had so many raw vegans. And I was like, oh my gosh, your body's so depleted. Please eat something cooked for me, please.
So there's a question, going through your cancer center would be the best route to find a physician or expert in acupuncture. Is that correct? Especially if you have Medicare?
Let me see here. So, I don't know about the other cancer centers, how they do it. If you have Medicare, you would have to definitely call their integrative medicine department if they have one. I know Advent in Orlando has one because my girlfriend is a radiation oncologist there, and she told me they have an acupuncturist there. But I don't know. It would be covered under Medicare.
We can't thank you enough, Dr. Lee.